And we are live. We are live. We are live. Welcome, 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 good people. Welcome. We are live. We are live. We are live. I'm so excited. Tuesday Talk gets the best guests on the show. I'm so excited for it. Come on in, people. When you come on in, let me know where you are, where you're from, and where are you. Let me know what's good, what's going on with you. Just waiting for a few people to arrive. Welcome, welcome. Come on in. Tonight, we have a return guest. We have Dr. Daniel Laroche. Dr. Laroche is a fan favorite. I have to acknowledge that, people say we want this person back. We want to hear more. And it's really great feedback to know that we have guests that people really want to see and enjoy and learn from. And it makes a difference in your life with the information that you have. Okay. I want to thank you for your support with Tuesday Talk. It makes it a lot easier to get guests. I'll tell you that much. Please share this and bring as many people into this space as you can. Okay. This evening, we are going to be talking about a problem and a solution. On Tuesday Talk, we don't debate. We don't roll around in the mud. We don't speak without facts. And we don't just talk about problems and then leave. Tuesday Talk is centered around Kemetic spirituality, other African traditional religions, and Pan-Africanism. A part of all three is self-accountability. It's you being accountable for yourself and for your actions. Okay, so tonight we're going to be talking about, one of the topics we're going to be talking about is glaucoma. And we're going to be talking about that because it is something that affects the African-American community. I don't typically use the term African-American, but I'm talking about Black people in America, United States of America, who live a certain lifestyle that's not healthy, it's unhealthy, and it leads to adverse health effects, and one of which is glaucoma. Glaucoma it affects your eyesight, it affects your quality of life, and it's something that is definitely preventable. So it's something that we want to make sure that people know how they can empower themselves to prevent this, right? To make some changes to prevent this. I am going to get on social media, and I would like for you all to get on social media and to share that this is live. This is now live. Please come and join us. We are now live. Please come and join us. So everyone go to your screen, go to your social media and let it be known. I'm going to send a quick little notice, making sure people know this. Come on in. Come on in. Please join and share. All righty. There we go. I see some people coming in. When you come into the screen, please let us know where you are coming in from. Please let us know. Okay. So without further ado, I am going to bring our guests on for this evening. Tonight we have Dr. Daniel Laroche. And I have to admit, Dr. Daniel Laroche is one of the most versatile people you'll ever meet. He's an ophthalmologist, which means that he's not like you go buy eyeglasses from him, even though you can. He's not the guy who you just get an eye test, even though you can. He is a surgeon, which means he went through 4 years of medical school, a surgical residency, and then specialized in surgery for the eye. He's a very well disciplined, well trained man with elite education, because by the time you are operating on somebody's eyeballs, you know a whole lot. That's an elite level of people on the planet. At the same time, he was at the Happy event in Queens like a year or two ago, and he was so excited to see Brand Nubian, right? And he was in the front row, chilling, having a good time. So he's very relatable. And if you ever get an opportunity to go to his Queens or his Harlem office when he has time, he will sit and talk to you about whatever, and you will be laughing. So this is why Dr. Laroche is one of my favorite people, because he's very relatable and very genuine. And without further ado, I'm going to bring him on here so you can meet him for first time or second or third time. Let's all welcome Dr. Daniel Laroche. Welcome, Dr. Laroche. How are you?
Akama'at.
Akama'at.
Okay. Peace to the family. Congratulations to the Shrine of Sekhmet.
Thank you.
Peace to the Shrine of Ma'at, Jabari and Ika.
Mm-hmm.
Peace to the Studio Patah, Baba Hiru. Okay, Akama'at. Thank you for having me. Thank you for the introduction. Thank you. Mm-hmm. It's great to be here.
Yes, and I also forgot one thing, and I'm slightly embarrassed that I forgot that. Dr. Laroche is also a Kemetic priest. He was given the title directly from Baba Hiru. Now, people might think that just having these titles, priests, just, oh, you're a priest, like when Oprah was giving out cards, and you're a priest, and you're a priest, and it doesn't work like that. But we do a lot of work, more work than you know. And when you consider the work that is done, it's the work that needs to be done in the community. So it might not all look the same. Okay, it might not all look like how you see in Tepe Dr. Anika, or in Tepe Jabari, or Rasaku Kepper and Hamet and Bar from the Temple of Anu. Those they are recognizable priestesses and priests, right? They do the work of the spiritual work inside the shrine or inside their temple with prayer and giving ascension and communion. And so it's clear to us that they are priests and priestesses. But you must understand, Hemet Neter or Hem Neter, that means divine servant. It means the work that is done. And when you consider the work that Dr. Laroche has done, he is a divine servant. Dr. Laroche, where did you go to undergrad?
I went to New York University undergrad.
NYU. NYU is such a dope school, you guys. He went to NYU undergrad. And where did you go to medical school?
Cornell University Medical College in the city.
Cornell University Medical College in the city, as opposed to in Ithaca, where in Tepe, Dr. Anika and Dr. Jabari both went to school. They went to school in like the bricks of bricks, like just very cold Ithaca. Okay. And what was your major in undergrad, by the way? Curious.
I was a chemistry major.
Ooh, so you did general chemistry your freshman year, organic chemistry, P-Chem, yes, all that?
Correct.
You liked all that stuff?
Well, I knew I was going to be interested in medicine and the sciences. Mm-hmm. And I did like chemistry. One of the things I liked about the sciences is that 2 + 2 = 4. And so there's always a correct answer at the end of the chemistry equation. And I felt like, okay, if I can study this and get the correct answer, that's fine. I always had a hard time with writing, because when you're writing an essay or you're writing a report, there's a huge amount of subjectivity. And I felt I could never measure up to the teachers coming up the path. And I felt that I can never get my due due to biasness or whatever. So I said, you know what, let me stick to the sciences, because I can master that. And, and so I just felt like I had greater control of my destiny in the sciences.
Oh, wow. That makes sense, because there's not much to interpret when you're balancing out a chemical equation. You're trying to find ma'at, actually, when you're balancing out those chemical equations.
And then even when you're advancing science, it's either works or it doesn't work. Mm-hmm. You do studies, and you can do different research projects, and you can test different things out. And as long as you can demonstrate something works safely and effectively, you can advance science.
Mm-hmm. So I never looked at it like that, but yeah, Definitely, that's true. And there is a level of ma'at in the sciences. When did you come to the realization that there's a level of like that, like health is internal ma'at? When did you come to that realization?
Well, in the sciences and medicine in general, you really have to have the excellent character that Ma'at brings.
Mm-hmm.
Because when patients come in, they're very vulnerable.
Mm-hmm.
Usually they have something that ails them, they need help, they need assistance. They're going to tell you things they don't even tell their own family members, their own spouse about what's going on in their life. And so they have an enormous amount of trust in you.
Mm-hmm.
You have to really carry that character very strongly for them to trust you, to give you the correct information. Because only when you get the correct information about what's going on that's affecting that person's life or health can you really then help them with what they need.
Right. That's true. That's very true. You do have to go into it with a certain level of character for all the reasons that you said. So, what made you specialize in ophthalmology?
That's a good question. When I first went into medical school, I didn't even know what ophthalmology was. I thought I was
Mm-hmm.
going to do perhaps internal medicine or surgery or even psychiatry.
Mm-hmm.
But with psychiatry, when you're dealing with a lot of inpatient psychiatric conditions like schizophrenia, it's very chronic, and sometimes you don't have really good long-term solutions to that. And so it wasn't what I thought it was going to be, because I was always interested in like the psychology and psychiatric issues that affect the Black community. So I thought that I was going to go in that space. I really liked general surgery
Mm-hmm.
in terms of operating, but the training for general surgery was very vicious. It was very sadistic. And I felt like I'm not going to survive this. They're going to read about me in the New York Post
Oh wow.
of going postal on somebody. So I said, no, I can't do that. And then I ran into ophthalmology,
Mm-hmm.
with a specialty where you could do surgery on the eyes, and then see patients in the office. And the
Okay.
ophthalmologists were very friendly,
Okay.
and the training was very friendly. It's very positive. And so I found out about this towards the end of my medical school years. And then the other thing is when you look inside the eye, you can actually see pathology. When you look
Mm.
inside the eye, you can see the optic nerve, you can see the retina, you can see diabetes, you can see glaucoma, you can see different diseases that affect the body by looking inside the eye of someone. You can see how healthy or unhealthy they are. And so you can see the pathology, and then you can intervene surgically to solve the pathology too. And so all those things attracted me to ophthalmology.
Okay. So, there's this woman on Instagram, and she says that by reading your eyes, she can see illnesses. Now, she's not a doctor of any sort, as far as I know. Is that true, or do you have to be a trained ophthalmologist like yourself, or is that just IG nonsense?
There's a space called iridology.
Hmm.
It really doesn't have much science behind it.
Okay.
And there are a lot of people that tout that they're doing that or they're experts in that, but there's nothing really, no good science behind that. And so when you're talking about reading somebody's eyes, I would be very cautious about that. But you can look at people's eyes and see different things. We can see cataracts. We can see jaundice if the white
Hmm.
part of the eye is yellow. We can see corneal scarring. So by looking and examining the eye, we can definitely see a lot of disease and pathology. But I'd be cautious about reading an eye that looks normal. I'd be cautious about that type of wording.
That is what that she says she's an iridologist and she does iridology. I'm like,
Yeah, I've not found any science behind that, and I don't
yeah.
find any reason to scientifically recommend that.
Okay, good. Good, good, good. So now that's coming from the NYU Cornell trained ophthalmologist. Where did you do your residency for ophthalmology?
I did my internship at Montefiore in internal medicine for a year in the Bronx. Then I did ophthalmology 3 years at Howard University in Washington, D.C.
Okay, HBCU in the house, Spelman and Howard. Okay. Tangent, how'd you like your experience at Howard?
It was great. It was my first time at a historically Black university. One of the things that, when you're at an institution like that, the whole issue of like white supremacy is like so much out the window, because most of the colleagues around you African descent, the teachers are African descent, and everybody's trying to genuinely learn and teach. And so the whole racial thing is for the most part out the window. And I really enjoyed that experience.
Yeah.
So I was very grateful to have the opportunity to become an ophthalmologist at Howard University.
Oh, awesome. I love that. And so I must concur. I graduated from Spelman College. I spent my time there, and I would have it no other way, especially after having gone to prep school for 7 years. And I would have had that no other way. I had an overall good experience at my prep school, but it was time. It was time for some Hillman College, baby. Let me tell you, for sure. So getting into glaucoma. So can you define pathology? Can you define glaucoma? And as we look at this through the lens of an African perspective and a Kemetic perspective and staying in Ma'at, how do we address like our role in developing and preventing glaucoma? Now that's a whole lot. Like I asked like 3 questions. I want you to present it in the Dr. Laroche way, but if you could, please, kind sir, address those issues so that we as Black people can really change our lens from wherever it is to these are the solutions to my problems.
I have a PowerPoint. Can I share my screen?
Oh, absolutely. Yeah.
Okay. So it's about a 20-minute PowerPoint. If you get bored, you can stop me and we can go back to conversation.
All right.
Let me try to share my screen here.
Okay.
Let's see here. So we're going to window, share. Can you see that?
I see it.
Okay, let's go from the beginning here.
All right. So Dr. Laroche, I am going to remove myself so you can have the space. If you want me back, just holler and I will come right on back. But you don't need me for this.
Okay.
Okay.
Right. So this is like about a 20-minute PowerPoint on new advances to prevent blindness from glaucoma with early cataract surgery and microinvasive glaucoma surgery. So what is glaucoma? Glaucoma is a condition with increased pressure in the eyeball that causes gradual loss of sight. What causes glaucoma? The enlarging lens inside the eye is the most identifiable cause of glaucoma. Here's a video. Let's see.
Glaucoma is a leading cause of blindness.
Can you hear the video?
Globally affecting nearly 80 million people. The eye produces fluid from the ciliary processes to bathe the eye. The fluid drains via the trabecular meshwork, aqueous veins, uveoscleral pathway, and suprachoroidal space. With time, the trabecular meshwork ages and the lens of the eye becomes larger, developing a cataract. This narrows the drainage angle, reducing the ability of aqueous to drain from the eye. Additionally, in some patients, the zonules that attach the lens to the iris rub against the posterior iris, releasing pigment that further blocks the outflow pathway. This, in addition to genetic predisposition in some patients, leads to elevated intraocular pressure. This increased pressure goes on to damage the optic nerve, described as cupping. When this occurs, medical therapy should be initiated. Since as many as 50% of patients fail medical eye drop therapy, early cataract extraction can be performed to open the angle, and goniotomy should be performed to remove the damaged trabecular meshwork to help improve aqueous flow. Patients with advanced glaucoma due to worsening outflow will need an additional intervention.
So in addition to the lens getting large inside the eye contributing to glaucoma, you can also get what's called choroidal expansion. This is the choroid is the vascular lining behind the retina that could expand, okay? And then when it expands, it pushes the lens forward, closing off the drain, leading to an attack of glaucoma. There's a variety of medications that can do this: psychiatric medications, neurologic medications, topiramate, respiratory, over-the-counter cough medications, sulfa medications, heparin and warfarin, anticoagulants, and neuromuscular medications. That's why it's really important for everyone over 50 to get their eyes checked to see if they are at risk for this. There are over 3 million Americans that have glaucoma, but only half know that they have it. In the US, more than 120,000 people are blind from glaucoma, accounting for 9 to 12% of all cases of blindness. Glaucoma is the second leading cause of blindness in the world, according to the World Health Organization. And blindness from glaucoma is 6 to 8 times more common in African Americans than Caucasians. Other high-risk groups include people over 50, family members of people who have already diagnosed, diabetics, people who are severely nearsighted, thin corneas, and estimates put a total number of suspected cases of glaucoma between 60 to 100 million. My approach to glaucoma has really evolved to a new surgical algorithm. In patients over 50, we could do early cataract surgery and trabecular bypass surgery to help even prevent glaucoma if you catch it early enough. Then, if patients need medications or laser, they can get that. The trabeculectomy, which was the gold standard, is declining. You don't need to do that as much. We have a new retrobulbar intracorneal tube shunt technique that works very well for advanced patients. If you touch your eye, the normal eye pressure is around 15. In patients with glaucoma, the pressure on average is about 18 or higher. And you can see here, most people with a pressure of 15, they don't get worse with their vision. But as the pressure goes up higher, they can lose visual field. And we look at the optic nerve inside the eye, and this would be a normal optic nerve over here. And over here, you get thinning of the inferior neuroretinal rim. And we can see that when we look inside the eye to confirm the presence of glaucoma. And you can see this patient with thinning of the neuroretinal rim, a hemorrhage on the optic nerve here. Okay, this you can see. And what happens when you have elevated eye pressure, that triggers an autoimmune cascade leading to the death of retinal ganglion cells. And these are the retinal ganglion cells in the retina. Okay, there are 10 layers in the retina. And these are the cells that are affected, killed off by the T cells, okay, that leads to loss of vision. And when the IOP increases, you can see here as the eye pressure goes up, the T cells, which are autoimmune cells in your body, attack the retinal ganglion cells, leading to glaucoma. And that can lead to cell death and loss of vision. So by keeping the pressure low, that improves the blood flow to the eye, reduces mechanical stress, prevents autoimmune cascade. And this is where diet is important. Eating lots of salads and vegetables, fasting, drinking lots of water, exercise, walking 8,000 steps a day is all very important to your health. And meditation and relaxation. So why do people still go blind from glaucoma? Well, I think glaucoma is still improperly being treated today. We use eye drops, but we know that when people are taking eye drops, about 50% of them can be non-compliant for one medication, 61% non-compliant for two medications, 70% for multiple medications. 90% of patients do not refill their medications continuously over a 3-year period. And 22% of patients are on 3 medications or more, making it very difficult to comply with. Here's an example of a patient trying to put an eye drop in. And you can see they're missing the eye drop 1, 2, 3, 4. They're touching the drop with the tip, contaminating the drop, and they're going to run out of that bottle before the end of the month. Now, you can train patients to take eye drops properly, but it's a problem. And that was just one bottle she was trying to take in. And imagine if you had to try to take 2 or 3 bottles of this. And we also know that even if you don't miss the doses of medications, you can still lose vision over time. And the more doses you miss, the worse the vision deteriorates over time. So that's what we like to do with a surgical approach earlier. Here's a patient of mine who was on 3 medications. Okay, the eyes were red. She was having allergy. She was very miserable. And these medications have BAK, which is benzalkonium chloride, which is a detergent preservative that's very highly toxic to the goblet cells of the eye and can cause damage to the cornea. So this brings me back once again. What's the main cause of glaucoma in persons over age 50? The lens thickness increases with age. And this enlarging lens that increases with age is also correlated with increasing eye pressure. You can see here the lens that can increase by about 30% with age. And when the eye pressure goes up, we take a look, we put a lens on the eye to do gonioscopy and take a look at the drainage angle. And you can see this is a drainage angle over here, but in glaucoma patients, they'll have increased pigmentation in the drainage angle, as you can see over here, from the lens rubbing up against the iris. We developed a calculator called the Laroche glaucoma calculator, where we look at age, when we assign a number, eye pressure, we assign number, and central corneal thickness, when we assign number. The thinner the cornea, the higher the number and the higher the risk. The thicker the cornea, the lower the number, the decreased risk. If you score from 0 to 5, we reevaluate you 1 year for recommended reevaluation. If you're 6 to 18, that's a high risk, and we recommend a complete ophthalmic examination. And it's a very high risk of you having glaucoma or being a glaucoma suspect. And we calculate a very high sensitivity with this, with the statistics. And we now offer free glaucoma screenings in our office, where anybody who wants a free glaucoma screening, we give them this calculator and we do these measurements to see if they're high risk or low risk. It takes about 10 minutes, and we offer this as a service to the community. And you can see here what happens over the age of 50, whether you're in Asia, Africa, Europe, or North America. The prevalence of glaucoma increases over the age of 50. And in all ethnic groups, European, African, Hispanic, Asian, over age 50, the numbers of glaucoma starts to rise. But it's highest in the Latin and Caribbean nations and blacks, and highest in people of African descent. Why is that? It is like that because there's decreased access to care, a decreased number of black doctors in the community that can provide access to earlier cataract surgery. In the United States, there's 30% decreased access to cataract surgery compared to whites, and in Africa and the Caribbean, it's even worse. Well, whatever else happens over age 50, you can see here over age 50, the prevalence of cataracts increases as well. And so what happens when you have a cataract? You see this large lens here inside the eye, rubbing up against the iris over here, okay? And that narrows the drainage angle, okay, leading to elevated eye pressure. But once we do cataract surgery, we take this cataract out. Look, we put an intraocular lens here. We've performed cataract surgery. What happens to the drainage angle? It opens up. And guess what? There's no more lens iris rubbing. That's eliminated. And that lowers the eye pressure, and that can solve the problem when you do this early enough. On the lens, you have these zonules here that hold the lens in position. These zonules rub up against the iris, okay? And you can see here on the clinical examination, you can see pigment on these zonules from rubbing up against the iris over here. And then when I see someone like this, we put a lens on the eye and then see the pigment in the drainage angle. You can see here also the lens rubbing up against the iris here. As this lens gets bigger, that leads to pigment liberation, okay? And what happens to that pigment? That pigment blocks the drain, as you can see over here, okay? Contributing to elevated eye pressure. Now, this is a normal drain. This is called Schlem's canal, which is a canal that drains the fluid out of your eye. And this is trabecular meshwork. And as the heart pumps, this is a normal pumping of the drain in your eye to keep the eye pressure low. In glaucoma, the drain gets blocked up, the canal decreases in size. And in advanced glaucoma, you see the drain is very blocked up. The pumping mechanism is much, much less. And this is what we want to try to avoid. But by doing an earlier cataract surgery, we can prevent this and preserve the drain inside the eye. And you can see here with earlier cataract surgery, the drain in the eye opens up by 2 to 4 times. And if you don't do cataract surgery, you do other types of glaucoma surgery, and you leave the lens in the eye, the lens will rub up against the iris, releasing pigment, and it will close off other types of glaucoma surgery like trabeculectomy. We published this paper, Cataract Surgery Reducing Pigment Particles in the Anterior Chamber. This was Joe Sinon. At the time, he was a third-year medical student at downstate. Now he's an ophthalmology resident at downstate. We published this paper, The Aging Lens in Glaucoma in Persons Over Age 50, why early cataract surgery, refractive lensectomy, and microinvasive trabecular bypass can prevent blindness and cure elevated eye pressure. We were able to get this word cure into the scientific literature here. This was Pamela Kaplan. She was a medical student at Cornell Medical School, and now she's an ophthalmology resident. We know from many studies that early cataract surgery lowers eye pressure. This is from Taiwan and England that shows with increasing cataract surgery, angle-exposure glaucoma decreases over here. We published this paper looking at the real-world efficacy of the Hydrus microstent in Black and Afro-Latino patients with glaucoma, a retrospective study, and we were able to show stabilization of the visual field in patients that had undergone this procedure. And doing the cataract surgery earlier in patients with clear lenses with glaucoma, with Hydrostent in Black and Afro-Latino patients, a one-year retrospective study, when you can do this in patients at mean age of 67 versus 73, you had excellent lowering of intraocular pressure, and 82% of our patients no longer needed glaucoma medications, okay? And this is the stent, the hydro stent that we place inside the eye that bypasses the obstructed trabecular meshwork that's blocked off by pigment to restore the outflow here. And you can see here, this is an ultrasound showing a stent here that's keeping the canal open. And you see an echoing over here from the ninitol stent. And you can do MRIs with this as well. And we're able to show preservation of visual field. The mean rate of visual field loss is about 3% per year in glaucoma patient. If you treat with several eye drops, you can lower that, okay, by lowering the eye pressure by about 10 points. But like I told you, it's very hard for people to take the eye drops. And so this study shows that with surgery, with the hydrostent, after 4 years, it does much better in terms of not only reducing medication, okay, and reducing the need for major surgery, but also reducing visual field progression. This group with the hydrous microstent compared to cataract surgery alone, really able to save the vision. And we also know that the longer you wait for people to do surgery, they don't do as well. If you're taking eye drops for many years, the success rate of the glaucoma surgery is not as good. So now when I talk to patients, now that surgery is much safer, that earlier surgery works better to help increase the risk of your chance of getting off of medications. So is there a way to intervene earlier to reduce visual disability? This is the patient with glaucoma that eventually goes blind. If you intervene too late, they can still go blind. If you intervene earlier, they still can decrease vision but preserve their vision. What I'm saying is that now with very early cataract surgery and microinvasive glaucoma surgery, we can actually prevent glaucoma in some patients and really stabilize their vision very well. Now, in this study looking at the effectiveness of microinvasive glaucoma surgery, the complication rate was very low, about 2% for goniotomy and canaloplasty with cataract surgery.
Now, hello, Mr. Stroud. How are you?
Here's a patient.
I'm fine, thank you.
Okay, thank you for participating in this interview. Just want to confirm, do I have your permission to do this interview?
Yes, you do.
Okay, great. Now, you had a history of glaucoma and cataract in the right eye. About a year ago, what was it like, taking eye drops in the right eye?
It was not difficult, but a little burdensome because I had to do it twice a day, morning and night.
Okay. A few months ago, you had cataract surgery and the hydrous stent done. And how's that experience been with your eye now thereafter?
The experience was good. I'm so glad I did it. And I think the one thing that I noticed most of all is the colors are so much more vivid than they used to be for me. It's been great.
And you're still taking eye drops in the right eye?
No, only in the left eye.
So the pressure's under control?
Yes.
Do you know what your pressures were before the surgery on eye drops and after the surgery on eye drops?
I remember numbers like high teens to low 20s. And now today I had, 10 in this eye? So it's much better.
Okay, great. Thank you so much for sharing your story.
Sure, my pleasure.
So you see, this is what we can do for patients now. So patients don't have to go blind. Okay?
Yeah.
And if we catch it early enough, and then we're almost done. This is a new technique, a Laroche glaucoma retrobulbar tube technique for patients with advanced glaucoma. And this is placing a tube in the front of the eye and diverting aqueous to the retrobulbar space behind the eye. This device is not available in the United States. It's under study in Spain right now, right? But the results were really good with this technique when I saw it at a scientific conference in terms of lowering eye pressure and getting people off of medications. So I came up with this technique using some hardware that we have available, a valve, okay, to divert aqueous to the retrobulbar space. And this is the technique where we're adding this tubing to divert the aqueous to the retrobulbar space. And in this initial report, looking at 10 patients, the mean age was 68. And you can see here with sonogram, and we were able to divert aqueous to the behind the eye to lower the eye pressure. We did this at MRI showing aqueous outside of the eye behind. Are you okay, Abud?
I'm good. Just the
Okay.
pictures are so.
And here you can see aqueous behind the eye. So this is like really new information over here. These patients had an eye pressure of 25 on 4.5 medications, but after this procedure, the pressure came down to 11 on only 2.8 medications, and the visual field was stable. And so the tube that I place is behind the iris, so you don't get complications of exposure of the tube that could be seen when you don't place it behind the iris. And so with these techniques, this provides new hope to people with advanced glaucoma. Couple of the additional papers to read are Preventing Blindness from Glaucoma with the Nidec GS1 gonioscope, lensectomy, microinvasive glaucoma surgery. We published this report, How to Stop People from Going Blind from Glaucoma Using Early Cataract Surgery, Refractive Lensectomy, and Microinvasive Glaucoma Surgery. And this chapter on refractive lensectomy and microinvasive glaucoma surgery, an initial approach in glaucoma patients over 50. We teach these techniques in Nigeria here and Haiti here. So in conclusion, all patients over 40 should get annual eye examination. Earlier cataract surgery and trabecular bypass microsurgery can help be performed earlier in glaucoma patients that prevent glaucoma, decrease rates of blindness from glaucoma, and avoid complications of more advanced surgery. Retrobulbar intracorneal tube shunt surgery offer a new hope for patients with advanced glaucoma. And also, this we could talk about later, but I started an organization called the Pan-African Glaucoma Association.
Oh, wow.
We'll be having our first Glaucoma Congress in Accra, Ghana, June 27th to 29th at the Alessa Hotel. We have over 125 glaucoma specialists from throughout Africa, Europe, the United States, and Caribbean that are members of the organization. And we expect a few hundred people to be out here to talk about glaucoma, preventing blindness from glaucoma, and also just reconnecting with the motherland as well. So thank you for the opportunity to talk about glaucoma for this first part of the Tuesday talk. This is my address in the Queens office. This is my address in the Harlem office. This is my email address here and my website. You get more information and more videos as well. And so I'll stop sharing the screen for this part and go back to you.
All right. Okay. Okay. There we are. Oh, wow. We have people in chat. Awesome. We have people in the chat. I had it on the big screen. So I'm going to just go over some of the comments and then also some of what Dr. Laroche was discussing. And y'all, I wanted to be a doctor at one point until I realized I'm way too squirmy for that stuff, and I'm good. And so, yeah, Dr. Laroche kind of called me out as I was trying to have my poker face on, but clearly it was my tic-tac-toe face or my Uno face because he called me out on it. So I wanted to go over a couple things. Can you explain to us in layman's terms, in non-medical student terms, the technique that you developed, and hopefully you have it patented and trademarked?
Okay, it's a technique where you're diverting aqueous from inside the eye to the space behind the eye called the retrobulbar space.
Okay.
Right now, most of the surgeries that we do just diverts the fluid to the subconjunctival space, which is below the eyelid, but that tends to scar down and close up. When you divert the aqueous to the retrobulbar space behind the iris, behind the eye, there's no scar tissue there, so it doesn't scar down. It doesn't close up. And I've done about maybe 70 of these cases, and we've had excellent results. We're presenting some of our work at the American Glaucoma Society meeting that's going to be in Huntington Beach, California at the end of February. And we have a paper that we're about to submit as well talking about this. And we'll be showing a video at the AGS conference as well. It's been accepted, describing this technique. So it's very exciting. It's a matter of getting the information out. I'll be talking about this at the Pan-African Glaucoma Congress as well in Accra at this upcoming summer as well.
Okay. Can you talk about the cure? Because I know that in order to say certain words and have them published, et cetera, there has to be a significant amount of scientific fact behind it to prove it. So can we talk about that cure a little bit more in depth?
Yeah, some types of glaucoma we can actually cure and actually prevent. And it's related, most of glaucoma is related to the lens inside the eye. The lens grows with age inside the eye. Your eyeball doesn't grow, but the lens grows. And when that lens grows in size, it takes up space inside the eye. It compresses Schlemm's canal, rubs up against the iris, releasing pigment that blocks a drain, narrows a drain, and that causes the eye pressure to go up. So when you pick that up early enough, if you intervene early enough to take that cataract out, you can lower the pressure and in some cases prevent glaucoma. Now, the thing is, to do this, you have to be a good surgeon, though, okay? There are 26,000 ophthalmologists in the United States, but only 10,000 actually do cataract surgery. And even a small amount do cataract and glaucoma surgery, which is what I do. So you have to really find that right person. Most ophthalmologists are not going to be able to offer you this technique. All they'll be able to do is offer you eye drops or laser, okay? But not really solve the problem of taking the lens out in those patients that have that problem. So the challenge is to train more surgeons, educate more people about this, and as you educate them and they can see that it works, they'll be more likely to refer people to surgical specialists for this. And so that's what I do, is trying to educate people, train people. And, you know, when I give lectures, my research is all about trying to educate people online and in person as well.
Okay. How many people can do what you do, Dr. Laroche?
Well, like I said, I mean, there are hundreds of us that do glaucoma surgery and cataract surgery, but compared to all the eye doctors, it's a smaller number. We need to expand that.
Mm-hmm.
Expand that. But I've been doing this for 25 years.
Mm-hmm.
So I'm at like, you know, I'm up at the top of my game over here.
Right, right. So translation, you're looking at the best. That's what he just said. You're looking at the best. And he should say that. So let's talk about this. Glaucoma is 6 to 8 times more common in African Americans. Please explain how our lifestyle contributes to the development of glaucoma.
Well, I mean, some of it's genetic.
Mm-hmm.
Some of it's not accessing eye care.
Mm-hmm.
And not going to the doctor. And we have decreased access to the doctor. Like, for example, you know, due to the history of America and the racial divisions in America, for many years, Blacks were not allowed to be trained to become a doctor. And so that led to a huge shortage of ophthalmologists and eye specialists. And those that are in that specialty, they tend to work in the majority communities. Throughout America, the railroad tracks divide communities. You know, almost any city you go to in America, you're going to find the railroad tracks. You're going to find the white community over here, the Black community over here. When you go into the Black community, you're going to find very few eye doctors there. So there's decreased access to eye care as well. So that decreased access, that decreased knowledge leads to delayed care. And so that's why people, and then decreased access to cataract surgery, decreased health insurance, and things of that nature, that leads to delayed care. But if you can get your eyes checked, you can get picked up early. If you do have glaucoma, have earlier intervention. If it's large lens related, with earlier cataract surgery, microinvasive glaucoma surgery, the rates of blindness can decrease dramatically.
So what's a good age to like get a preemptive surgery so you can preserve your vision? Like,
the thing is, what I recommend is, you know, over 50. I use 50 because over the age of 50, if you have a risk factor, and you have to have a risk factor though. I mean, you have to have high pressure, thin corneas, family history. If you have like a lot of risk factors and it's suspicious, you know, then you can do something early to help prevent glaucoma. Narrowing of the drainage angle, like the angle is very narrow. I'll do early cataract surgery in those patients, but you have to have something. And usually you'll find those people over the age of 50 that have that. And the thing, what's nice about age 50 is that at age 50, most people need reading glasses. And with the new lens techniques that we have, it can get you out of reading glasses, lower your eye pressure, improve your vision, and you're much happier.
So Dr. Laroche gave me a glaucoma screening. And I don't remember off the top of my head what the results were, but it wasn't anything pre-glaucoma, if I remember correctly. Do you remember, Dr. Laroche?
Oh no, it was you were normal. Trust me, if you were abnormal, you would know about it.
Okay. So for someone who's normal, when would be a good time to say, hey, do we need some intervention? Like, my mom does not have glaucoma. My grandmother doesn't have it, as far as I know. I don't remember anyone saying that my great grandmother had it. I mean, I also never asked, and I don't have it. I'm in relative good shape. My blood pressure is normal again. My blood pressure and my weight I had maintained my weight from 17 to 42. Then the same weight, same percent body fat, didn't miss a workout. Then I went through a series of deaths in my family and just, gained 20 pounds and, yo-yoed. My blood pressure was up. Over the past couple of visits to the doctor, my internal medicine doctor, my blood pressure is back in the normal range for the first time in quite a while, actually. And I'm still 10 pounds overweight, in full disclosure. So I don't think that those are necessarily risk factors for glaucoma, but all things considered, including what my health was and then what it is now, and the kind of the hump that I went through, what would someone in my condition do to prevent even the development of glaucoma? Because I saw I was looking at your graphs. One of the graphs is if you catch it at the right time, you get to keep your eyesight. So with that little dot, when you get intervention, what designates that little dot?
Well, that graph were for patients who actually had glaucoma.
Oh, okay.
Or had were about to develop glaucoma.
Mm-hmm.
In your case, I would just recommend you get your eyes checked once a year. That's all.
Okay.
Get your eye checked once a year. Get your medical checkup once a year. Your blood pressure. Get your, for the ladies, GYN mammogram and breast exam. For the men, get your prostate and colonoscopy every 5 years. Just get those regular checkups, because we can pick up a lot of things early and intervene early and keep you living like a full life for a long time. I saw a patient recently who was very young. I mean, she was like her early 40s, but hadn't gone for a GYN exam in many years, and she developed cervical cancer that was spread and metastatic, and that decreases her life expectancy within the next 5 years or so. And that's something that can be totally cured in that respect. So it's just very important to get medical checkup, get your eyes checked up. I mean, January is Glaucoma Awareness Month, so that's why we're talking about glaucoma now. But and then if you have early glaucoma or suspicious for glaucoma with a lot of risk factors, then you can be evaluated for earlier cataract surgery to help you with that, or cataract surgery and microinvasive glaucoma surgery with a specialist. Someone asked about, is vitamin A good for your eye health?
Mm-hmm.
Vitamins are good. Generally, you can get your vitamins naturally from salads, fruits, vegetables. You can get all the vitamins that you need. For people who have macular degeneration, I recommend special multivitamins with lutein and zeaxanthin for the macula of the eye. And for people who are sick, like who don't have a good appetite, people with cancer who don't, eat very much, then I recommend the multivitamins every day as a supplement so they can get the nutrients that they need. But if you're eating a healthy diet every day, you're going to get most of the vitamins within the foods that you eat. I see another question.
Before we move on to the question,
go ahead.
I want you guys to kind of hear the theme that Dr. Laroche is saying. You should get your annual checkups. You get your teeth cleaned twice a year. Go and in one of those visits, you get your teeth and oral health checked. Make sure you're scraping your tongue, brushing your teeth, flossing, water pick. I go to the gynecologist once a year, and just like what Dr. Laroche said, you get the breast exam, the mammogram. I'm not 50, but I get a colonoscopy because my cousin died of colon cancer. My father had stomach cancer, and so because of that, I was eligible for early colonoscopies. They put you under, and they use a little tube, and it goes in the colon, and they see it on the TV, and then all you remember is laying down and waking up, and your butt is a little sore, like someone kicked you in the butt. I've never been kicked straight in the butt, but that's what it feels like. And you're kind of out for the day. You take a nap and everything is all good. But what it does is it checks your colon to see if you have polyps, to see if cancer is developed. My cousin died of colon cancer because he did not go to the doctor. He did not. So by the time they found it, it was too late and he died. My grandmother had a polyp, but because my grandmother goes and gets all her checkups on a regular basis, they caught it and snipped it out. My grandmother's almost 90 and she's out in these church streets with her homegirls. They go to movie premieres. And she be on Facebook and they're at dinner. They be kicking it. My grandmother has a better social life than I do. And part of it is because she gets she goes to her annual doctor visits. It's very, very important to do that. Just like what Dr. Laroche said, you can catch it early. My cousin, he passed. Clearly, he's younger than my grandmother. My grandmother, she's out having a good time enjoying her life because she goes to the doctor. Okay, my grandmother never been overweight a day in her life. Just basic normal stuff goes a very, very long way. Okay. So yes, the next question is from Kimberly Malone. Oh, one more thing. Dr. Laroche made some suggestions on what to take for your eyes. You can always just come back to this part of the video once it's available to watch and take notes on what he said. I'm also going to put his email in the chat and pin it. But I want to just get through these questions first. But it's important to be able to reach out to him. If you live on the Amtrak line, SEPTA, New Jersey Transit. What's the other one for New Jersey? New Jersey Transit that you can catch in New York. There's another one. There's two. My point is, you can get to New York City. You could take a day off and come to New York City. It is absolutely 100% worth it to come to New York City to make an appointment to see Dr. Laroche. Bring your whole family. All y'all can get your eyes checked. Because like he said, you have eye surgeons, you have ophthalmologists, you have eye surgeons, then you have the amount of people who can do what Dr. Laroche does. And that number is smaller if you're looking for a surgeon who is African-centered and African spiritual practicing and has a frame of mind like that care, not only generally cares about Black people, but very deliberately lives his life to create an environment that is warm and a place where you can learn about who you are. It's probably just him, y'all. I don't know. Dr. Laroche might know somebody else who's Black who has that kind of mentality. But he has two offices. I went to both of them. They're awesome. It is worth it for you to take that day off if you do not live in the New York City area and get your eyes checked with Dr. Laroche, please.
Well, for those people in the audience that are across the country throughout the United States, there is a website called blackeyecareperspective.com, and you can find a Black eye doctor there also throughout the United States. blackeyecareperspective.com.
See, you got me calling me out on my spelling.
Yeah. So blackeyecareperspective.com.
I hope that's right.
That's a good resource to find Black.
Okay, I didn't know that.
Yeah.
So Dr. Laroche, Kimberly Malone would like to know what diet or herbs can be used for eye health.
Well, the diet, once again, lots of salads, lots of vegetables, some fruits, not too much because it has a lot of sugar in there. Exercise, 8,000 steps a day. Meditation, 15 minutes a day. That works fine right then and there. In terms of herbs, there are some studies with herbs that can help, like ginkgo biloba, bilberry, but there's some that shows it does help, some that shows it doesn't help. Just the general green leafy vegetables is the best thing overall.
And I have to add in yoga and meditation. Yoga and meditation help lower your resting heart rate and calm your nervous system in general. So when you're in the real world, when you're off the mat, you're in the real world, people are cutting you off in traffic, you have the misfortune of meeting a Karen, your New York City commute was extra crazy, whatever. Your response is going to come from a space where your heart rate is already lowered. And when you spend enough time meditating and fasting, you're able to put things in perspective and you realize the things that got on your nerves, they're just not important. Like if you name the last 5 things that got on your nerves to make you lose your temper, you probably can't even remember them. because it's just simply not that important. So I have to add in there the benefits of meditation, learning how to breathe to the proper way, and not with your chest, but to lower the heart rate, making sure that you get better at yoga, deeper, increasing your flexibility. And over time, that flexibility becomes a part of what the space that's accessed in your body. And then you have greater mobility. When you have greater mobility, it's because you have released stress, you've released tension. Flexibility is a sign of tension that has been released. A lot of you might not know this. I was in a car accident on October 15th. I got a concussion, blah, blah, blah. I haven't worked out since then. And I am less flexible, and I feel tension in parts of my body that I did not feel before. And so my healing includes meditation so that I can have a clearer, more rested frame of mind when I process everything that I have to deal with associated with this accident. The other thing is this: you want to do a hot, sweaty yoga. Why? Because you're releasing toxins from your body, and the discipline it takes to be able to master that yoga also calms your nervous system. Black people, we definitely need that. Okay. And to answer some inquiries, yes, I am going to get back to teaching meditation. And yes, I am going to get back to Black Man Meditate. I would say look for that towards the middle to end of February, because I have had people ask me that. Yes.
Let me add one point about meditation. Something simple you can do for 10 to 15 minutes a day. You find a place where it's quiet in your home or in your workspace, and close your eyes and just sit quietly in a comfortable space and take some deep breaths through your nose. Slow, deep breaths for 10, 15 minutes. Breathe deeply through your nose. That lowers your eye pressure by about 20%. It can lower your blood pressure by 20%. And that just helps to calm you down as well. And that's very healthy for your body and for your mind.
Mm-hmm. So did we answer this question? What diet or herbs can we use for good health?
Yes, we did.
All right. And here's another one. I use brimonidine for redness in my eyes. Is that good? Maybe you can pronounce it the right way.
Brimonidine is a medication we use for glaucoma. Okay. It helps to lower the eye pressure. There's different strengths of brimonidine, though. The higher strength ones are used to lower the eye pressure. Some of the low strength brimonidine can be used to get rid of redness, but also brimonidine can cause redness sometimes. So, if it's a high concentrate and you're allergic, you can get redness from that. And you have to be careful of brimonidine use in infants and children, because that can cause sleep apnea and breathing problems in the children as well.
Okay. All right. So I think we have all of our questions answered that were in the chat. And glaucoma, in summary, is something that is relatively preventable due to lifestyle choices. So these are our solutions. These are our solutions, family. And we have to be responsible for our choices. It is fair to look at why we have chosen to do some of the things that we've done. And as a matter of fact, I feel like it's imperative that we do that so that we understand what is undergirding some of the decisions and choices that we make. All right. So what you do, that's the hardest part. That's the ugly cry part, when you face it. But you know what? Once you face it, you can only go up from there. I've had my ugly cry on certain things, and you just release all of it, because you're holding on to it. You release it, and it helps you make better choices just in general. And so, speaking about glaucoma and eye health, it will help you make better choices, specifically to keep your health under check, to keep your your vision. People, we're talking about health and vision. That's very important. Now, I have tagged or pinned blackeyecareperspective.com. Again, you can always look back at the video to make sure that you have that website. So we're going to segue into some of the more instructive stuff that Dr. Laroche has printed. He is a published author, and again, he is focused on working with the Black community, and in particular, our Black men. So as you can see, how to be a successful Black man. How many of you have this book? You should definitely get this because it will teach you how to be a successful Black man. Dr. Laroche, take it away. What inspired you to write the book? How did you know what to put in it? And how can we access it?
Let me share my screen again, actually.
Sure.
Let's see. What's that? Share screen.
I'll take myself out so you can have the whole screen. I'll be right back.
Let's see. Window. Can you see this here? Abud, can you hear me?
Yes, I can hear you. We can hear you. We can see it, but we can see that you're inside your mail. You have to click a button to just show the document itself.
Okay, I'm inside my mail.
Or inside something.
Okay.
Because we can see like the tabs on the left-hand side.
Oh, okay. The tabs on the left-hand side.
Right.
Let me stop. Okay, let me.
You don't have any trade secrets in there, do you?
Let's see. Let me stop sharing for a second.
Okay.
Okay, let me try. See if I can share the screen to present. Window. Share.
We still see the little side. Oh, that's better.
Is that better?
That's better. This will work.
Okay, good. So basically, I wrote this book because in the media, in TV, anytime you see Black men, you see a lot of negative stereotypes. Okay, and we get so many negative messages from the media, from the schools, sometimes even within our communities as well. And so, because of these negative stereotypes, I felt the need to say, hey, and then, we hear the statistics about fatherless homes, the Black family being broken up. And so I was very blessed to have my parents and my father and a lot of the things that I learned from him. And so I wanted to write this book. And then the other thing is the average reading age, the level of reading is about a 5th grade to 8th grade level. So I want to write something that was simple to help give guidance and pearls to young Black men around the world that are in a situation where you're dealing with white supremacy, negative stereotypes, the legacy of colonization, slavery, and discrimination. And so I'll just go through some of this. And I talk about some Kemetic history here. I use King Menes, also known as Narmer, who is narrating this, okay? And talk a little bit about introducing ancient Kemet, ancient Kush, ancient Nubia, ancient Egypt, in the Nile Valley, and its contribution to civilization out of Africa, starting over 200,000 years ago. Okay, and so there's a lot of good graphics here, good images, because in a lot of books you don't see positive images. Talking introduction about the Nubians and the pharaohs, the deities, Osar, Set, and Heru is being introduced, and the spirituality and the traditions. Akhenaten is being introduced, the Ankh, okay, and it's being introduced, and Ma'at is being introduced, and the 42 admonitions or commandments of Ma'at to help build character, which is very important. A big issue that we have is that, we've lost these traditions to build character and excellence with consistency and persistency. And so we talk about this, about knowing our roots, okay, and how, how we've been affected by white supremacy, and how it's very important to know our roots. okay, and how people have really tried to march against us. This is a quote from Napoleon. My decision to destroy the authority of the blacks in Haiti is not so much based on consideration of commerce and money, but on a need to block the march of the blacks in the world, you know? And so, you know, we want to educate, hey, these are some things that we are up against in that respects. And how, you know, we're so confused sometimes. We're trying to bleach our skin in that respects, and we're not proud of who we are. And some of the other traditions as well, and how, you know, there's a lot of land theft that we've been victimized by in the United States with the land theft in America. We're seeing land theft in Israel right now, land theft in Australia, land theft in South Africa. And so, you know, we talk about these types of things. These are issues that we have to overcome. The slavery even in Islam that took place and still takes place till today. And here we talk about Ma'at from the Papyrus and Ani, from the Persian Hiru. What are the admonitions of Ma'at? And these are the things that we should follow. Okay, these divine principles represented by the Ankh as well, and these teachings. And we go through that to teach kids, you know, these traditions are very important to help build character. Okay, and represented by Ma'at as a woman in the sitting birthing position with the feather on her head with the Ankh as well. And so we go through these admonitions over here, and we go through these teachings over here, and the negative stereotypes are there and what has caused these negative stereotypes. And then we outline some of the things that took place during slavery that was outlined in the Willie Lynch letter. And so the fear, the distrust, the envy that was, you know, indoctrinated within the Black community, you know, to divide us for light skin versus dark skin, old versus young, males versus females. And some of this still takes place today. And the breaking that took place, the N-word. And so we talk about these things, that what we have gone through, okay, in terms of breaking and seasoning. These are times of things that took place during slavery that had broke us down from the culture that we had and the traditions that we had, and taking away our language and our cultures and our traditions. So we talk about that. And let's see. And then here I get into a poem by Dr. A poem that they had, excuse me. This is a poem that was done in Europe called 10 Little Nigger Boys Going Out to Dine, One Choked Himself, and then there were 9. They would actually teach nursery rhymes to European kids about Black people and Black boys killing, like, you know, doing these bad things and dying out, you know. And this was a joke. And they did the same thing in America with the 10 Little Indians, okay? And it was a very derogatory type of thing to help, you know, introduce white supremacy in the youth, okay? And that's why I said the word nigger is not something in terms that we should use. We should never use this word within our community because there's so many negative connotations about that. And then we talk about some of the leaders like Marcus Garvey and emancipating yourself from mental slavery. So we want to introduce the youth, these leaders that we have in our community. The 10 Commandments, where they came from and how some of these are good, but that came from our traditions much later. And we talk about Osar and some of the letters or set, introduce these traditions to the kids, Heru and the anthropomorphic forms that existed, Ptah, okay, Ra and the creator of the ancient gods in ancient Egypt, Hathor, and so Anubis. So this is introduce these traditions, okay, and this scholarship with Tahuti, Amun, different letters here. And we talk about the importance of education and skills and knowledge and studying. Malcolm X and some of his quotes, teach them while they're young. It starts at home with who they are and raise them with the knowledge of self. And why it's important to own your own business, own your wealth, invest. A lot of time in our community, we talk about, oh, let me go find a good job. But when you're finding a good job, you're making somebody else wealthy. When you can build your own business and your own, set of wealth. I mean, we live in a capitalistic system. In a capitalistic system, you have homeowners and business owners, and you have renters and employees and workers. And so that's the makeup of the capitalistic system. So ideally, you want to be in the business owners and the homeowners because those people tend to do better financially in a capitalistic system. You want to support Black businesses in your community, okay? And spend money within the community, and we teach this concept also. And then, having family, man, woman, and child, the Trinity, marriage and education are highly effective in reducing child poverty in the United States. And you want to build yourself as a man to be the best person you can be, build yourself as a woman to be the best person you can be, so you could, both form a family together when you're ready. We have nice images of a Black man with his kids here as well. Don't do drugs. Right now, our communities are under attack with the legalization of marijuana. Smoke shops are opening up all over the place. They're putting up images of Bob Marley and Snoop Dogg smoking weed all over the place. And our kids' brains are highly vulnerable because once you start smoking marijuana at a young age, it really destroys your ability to think, destroys your sharpness, your ability for critical thinking, and it's going to make you a zombie. So we really got to teach our kids to stay away from the drugs, stay away from incarceration. Once you get incarcerated, it's very hard to function in society in terms of getting opportunities, jobs, and voting and things of that nature. So we talk about avoiding incarceration and the consequences of incarceration. And we talk about respecting women, respecting women. We have to respect the woman. The woman is very important part of a society. We all come from the womb of a woman. And so we cannot disrespect women and things that we do. And even Malcolm says here, we got a quote, the Black man will never get anybody's respect until he first learns to respect his own woman. And learning from your mistakes and growing from that, protecting your community, taking a stand against racism, we talk about, living in a capitalistic world, owning your own business. And so, although this book says how to be a successful Black man, it's also important for Black women. And I have 2 daughters, and I make sure that they read my book and read this book. And I told them, any guy you meet, make sure they read this book. If they are not down with what's going on in this book, then I don't want you to be around that person. I want to make sure that they are going to be in accord with what the principles are in here. And then we talk about trying to avoid police confrontation and follow the commands to avoid their, problem like George Floyd that took place. And then it ends here, and I'll just read this to you. This is one of my mentors, Dr. Gerald Deese, who was a nursery rhyme part 2 for survival. And it goes like this poem. It goes, one little Black boy was loved and he grew. He shared with another, and then there were 2. 2 little Black boys learned to agree. And then with the help of another, there were 3. 3 Black teenage boys learned to do even more. They lifted one who had fallen, and then there were 4. 4 young Black men learned how to survive. They joined hands with one another, and then there were 5. 5 young Black men built mortar and brick, and they encouraged another builder, and then there were 6. 6 Black brothers knew hell from heaven. They turned another brother around, and then there were 7. 7 Black students learned never to be late. A serious brother followed them, and then there were 8. 8 Black men became strong with time. They linked arms with one another, and then there were 9. 9 little Black boys became strong men. They looked for a leader, and then there were 10. 10 little Black boys are only a few. To become strong men and women will be up to you. So thank you. And so that's some highlights of this particular book.
I love that. Did you develop those rhymes yourself, Dr. Laroche?
No. That particular rhyme was from Dr. Gerald Deese, and I credit him. That was his.
Okay.
From Dr. Gerald Deese.
That's beautiful. I love that. How many of you have seen this book or who have this book? Dr. Laroche gave me this book a while ago, and I looked through it and read it, and it was great. And so this is what I mean when I say that he is multifaceted. How many ophthalmologists also write books? Let's see. Darius Shannon has a question. Last question. Can it be an autoimmune disease causing the redness? Oh, he's talking about back in the ophthalmology section. I don't remember the redness. Do you know what he's referring to?
I'm not sure. Autoimmune disease can cause eye redness. Absolutely, it can cause eye redness, and you may need some anti-inflammatory eye drops for that as well. Just like, whether it's psoriasis, sarcoidosis, lupus, we treat those with steroids and anti-inflammatory medications, and that could affect the eyes as well.
Okay. I hope that answered your question. I hope that was the right answer to your question. So, okay. So getting back to this book, what inspired you to write it, to like sit down and carve out time to write this, revise it, find a publisher, all of that?
Well, the thing is that I just felt that, I was very blessed to have a father in my life. I had a lot of mentors coming up when I was going to college at NYU, like the Dr. Deese, who was one of my mentors. I highlighted in the book and I shared one of his poems, the Ivan Van Sertima's, the Dr. Benz, the John Henry Clark's, the Gil Nobles, Bill McCrary's. There were just so many. And I think that, I'm not seeing as much of that in this next generation. And I said, okay, well, what can I do to do my part and impart some knowledge that I've learned to help, young men who maybe don't have a father, or young families that don't have a father. And maybe this will help, help give some guidance, single moms in that respects. And so, and just to have a conversation piece. And I got a lot of good feedback from those people that have gotten the book. A lot of my patients are supported with purchasing the book, people in the Shrine as well. And so it's out there. It's on Amazon. We've had sales internationally in England, Africa. Wherever I go, I bring some and I distribute it to the libraries. I've donated to many libraries in my travels in different places, both in the United States and the Caribbean and Africa, in that respects. So just to get the word out.
Okay. Okay, cool. And in how many languages is this book published?
Okay, that's a good question. I published this book in English. I also published it in French because in Africa, there's many Africans that were colonized by France and have the same experience that we have here in America. So I published it in French. In Brazil, a lot of the brothers in Brazil speak Portuguese, so I published it in Portuguese. And I also published it in Spanish as well for people like in the Dominican Republic and various Spanish countries that colonized and the large Black Afro-Cubans. They could read it in Spanish as well. So it's in 4 different languages right now.
Do you have it in Haitian patois?
No, just in the French.
Do you speak Haitian patois?
Not as much. More French, a little bit of Creole, but not as much.
If you want to translate it, I know somebody who speaks. She's Haitian and she translates Haitian patois and French. Just if you ever want to translate it to that. Oops, I wanted to push them.
Well, my the person that did the graphics is from Haiti, actually. Also.
Oh, cool.
The person that did the graphics is from Haiti, actually.
Do you understand Haitian patois?
Most of it.
Most of it.
I mean, most of it I do, but sometimes there's some phrases I may not be able to catch.
Okay. Cool beans. Cool. So, guys, again, so Dr. Laroche, do you have a website for the books?
I do. There's a website, How to Be a Successful Black Man website.
That's the name of the website.
Yeah.
Long name.
That's the website. And then for this particular book. And then I have another one. I didn't talk about that. If you want me to get into it, let me know.
Yeah, go ahead.
So the next one is called A World Before Genesis. Okay. And when you see that title of it, what do you think about?
I'm about to learn the truth.
You know, like when you ask many people, you ask them, what's the first book written? A lot of them will say, oh, it's the Bible. But I'll say, well, did you know that there were many books and many things written before the Bible? And when you have that conversation with them, there's like confusion there, and they wake up. And let me share my screen. Might I share my screen to talk about this?
Go ahead. Yeah.
Okay. So let's see. So
I'm learning this along with you, y'all. I didn't know he had another book.
window.
You'd be hard pressed to find a man more interesting than Dr. Laroche.
Let's see if it comes up there. No, let me hold on a second. Let me pull this up here. Okay. Okay, I'm going to share screen, present, share screen, window. Okay, it should come up now. Okay, you see it?
Yep.
Okay, so this is a book, World Before Genesis. And I want to give a shout out to Jabari and Anika, because my trip to Kemet with them really inspired me to write this particular book. I give a tribute to Asa Hilliard, who wrote the Master Keys of Interpretation from Kemet here. I cover these topics here. I gave a tribute to Ivan Van Sertima, and I talk about Africa and the Nile Valley landscape, the name of the territories in Africa before colonization, and the anatomy of the Nile Valley. Some of the myths, like Adam and Eve being the first people on Earth. But here, this is Dinkanesh. She's the oldest woman whose bones that we have. This is a picture I took when I was at the National Museum in Ethiopia. Okay, and then they called her Lucy because the Americans called her Lucy because that's when during that time that song came out, Lucy in the Sky with Diamonds. But the Africans called it Dinkanesh, which means you are marvelous. And we talk about some early cave art drawings. This is from the museum in Namibia that shows cave rock drawings here. We talk about the Lamomo bone and the Ishango bone from 35,000 years ago and 22,000 years ago that shows signs of early mathematics in Africa and what some of the people look like during this period of time. The Kustal incense burner, which shows some of the early deities in the white crown, and Hero here. This was at the, this is a picture I took at the Oriental Museum in Chicago. Talk about Bes, one of the deities amongst some of the people in Central Africa. Okay, some of the Twa people. You can see some of the Twa people here that still exist. And then some of the early pottery, some thousands of years ago in the pre-dynastic period. These are some pictures I actually took when I was at the Metropolitan Museum. And I love this one in particular. Look at this one right here. You see that one? What do you see, Abut? Abut, are you there?
I'm here.
What do you see in this picture?
I see Black women, I see afros, and I see hips and a little bit of attitude. That's what I see.
Do you know what I'm talking about? And this is before writing. This is like, pre-dynastic before writing. I mean, this is like, the goddess right here. Okay.
That's what I'm saying.
Okay.
Look at that.
This is a daughter. This is the husband. Okay. With the Heka. Okay.
Mm-hmm.
Power and authority. This is the son. This is a sign of the Netta. See the flag here? And the Sa, the son, the Sa of the Netta. This is like pre-dynastic over here. It's a fascinating piece.
You have got to send me that picture. Like, text it to me, please. That picture is for lie.
And let's see. And this is Bot here again. I mean, look at that. This is just beautiful.
It is.
So, and then this is Scorpion. okay, before Norma. And then we get into a little bit about the Norma palette over here. And we talk about what that is. Here's a picture of Norma. This is from the Petrie Museum. Jabari's spoken a lot about these types of things. Images of Ma'at over here. And so when I was in Kemet with Jabari, I realized, most people are not going to be able to make this trip.
Mm-hmm.
So how can we get this information to young folks, And so I said, okay, let me write this book. I can make it in simple format. So someone, who's young, they can have a taste of what's going on out there. And then maybe they'll be inspired to go. So that's what really inspired me to write this book. And we get into the 42 laws of Ma'at over here as well, represented with the Ankh. We talk about the judgment scene, and we break down the judgment scene here. The Seba'it, you see the Medunetter here. And we talk about the writings and the literature, the Shabaka stone, the significance of that, the Temple of Amen. You can see here some of the baptism and libations with the Ankh that took place here, and Osar, and then the Trinity with Oset and Heru. We talk about. You can see the images of Osar, and we have explanations here. And then, like, this is a picture I took at the Temple of Edfu when I was there, and explaining Heru and the different concepts. This is a picture I took of King Djoser here, okay, at the Cairo Museum. And you can see it. Look at the locks on this pharaoh. You see that?
He's one of my favorite because he looks like you cannot tell me he is not a black man.
Yeah, exactly. Okay. And so, and here's Imhotep. This was at the Cairo Museum as well. And Imhotep's. And we talk about the pyramids and who built the pyramids. Okay, with Imhotep building the first pyramid, and some of the burials and the tombs and the mummies. You can see these are African mummies here, and then this is Hesira, who was one of the first dentists. You can see here, this was the first dentist here, Hesira. These are pictures I took when I was at the Cairo Museum. Okay, and so Pyramid Unas we talk about, the pyramid texts, some of the earliest writings, the anatomy of the Nile, the Old Kingdom here, and the Palermo stone, Senefru, who built the pyramids here. And then we talk about like who built the pyramids, Senefru being the father of Khufu, and then Khafre and Menkaure and the different pyramids that they built, and how it's a family of pyramids that they built. Once again, Jabari's talked about a lot of these things as well. Khufu here. And the anatomy and some of the netters here we talk about. And so, and the boat of Khufu, Jedefra, and some of the glyphs, King Khafre, and the pyramids and the Sphinx. And so this is volume 1. This is going to be a 6-volume series. And I'm working on volume 2 right now. And so this is the tomb of Ptah-hotep, who wrote the first book. This is the pictures I took when I went to his tomb. You can see these pictures here. This is Ptah-hotep. This is the person who wrote the first book. Okay? How many of you have seen this picture of Ptah-hotep, the person who wrote the first book? Have you ever seen this book? Huh?
I don't think so.
That's what I'm talking about. This is directly from the tomb of Ptah-hotep in Kemet. Okay? This picture as well. This picture as well. Okay? And clearly you can see he is an African.
Period.
And we get into his teachings here. You can actually read his teachings here of Ptah-hotep as well. So in addition to the pictures, we put explanations, we write things down. So when you read this, if you've gone to Kemet, you plan to go to Kemet, this is a nice primer for you to give you a good foundation as to what you're going to see.
Mm-hmm.
So, And then these are some other tombs here as well. So, and then I have references here. So for additional reading, you can go to these other places as well. So I'll stop sharing. That covers that.
Dr. Laroche, I did not know you had written this book. I should have been the first person you called. A boot. I have a new book. I can come back on your show and talk about the book.
I thought I sent one to you, but I thought I sent one to you.
Not this one. You gave me the How to Be Successful.
Maybe I got the other one. Okay. All right.
I mean,
So-
you can send it, I'll buy it. You can give it however.
There's a website for this one called A World. No, I'll send you one.
Okay.
So there's a website called A World Before Genesis.
So www.world
Before Genesis.
before.
Teak well-being. Yeah, so you see the website there. So that comes up as well. And so
So
we have to do the work. I mean, basically, whatever space that you're in, whatever your specialty is, whatever your passion is, we have to do the work to be excellent, consistent, and persistent.
Mhm.
Okay? Have excellent character in what we do it with love, do it with passion, and then also talk about the history of it is what we do. Because you know what? If you do go back deep and you go back to the Nile Valley, you're going to find how they did it back then. And that will inspire you to do it even bigger and better now. And so you talk about the history, how it was done then, what you're doing now, and how you're taking it to the next level.
Yes, absolutely. That is so yes, before going to Kemet, like you should study and know some stuff before you go so you know what you're looking at when you're looking at it. Or else it's just gonna be overwhelming. It's just gonna be hot. It's gonna be a bunch of museums and pyramids. And it's gonna, I'm not saying it's not gonna be a wonderful experience, but you'll definitely get more out of it if you know what you're looking at. That's amazing, Dr. Laroche. That book is what I've been looking for, quite frankly. I think that's a great book for trips. That's a great book to introduce yourself into this space. It's a nice synopsis of, you know, some of the major contributions that we've made. I think it's a great entry point into this space and into learning this information. That book is gold. It's golden, and I can't wait for the other editions to come out so we can get that book in the mail when we get off Tuesday Talk. And I got something else I'm gonna say, but it's gonna be off camera. So please put any questions you have in the chat. The two websites that were mentioned tonight, I'm gonna update like I do typically in the same place where you found Tuesday Talk for tonight. I'm gonna put those two websites and contact information for Dr. Laroche so you can go get your eye exam, your annual eye exam, and let him be your primary eye doctor caring for your eyes and your vision. So before we go, I want to talk about the trip that Dr. Laroche took to. I'll let him tell you where he took the trip. It's where I've been wanting to go, and I saw it, and I'm like, I'm going. However, my homegirl, one of my best friends from elementary school, had her 50th birthday party and invited me and some other girls, and we went to Cartagena, Colombia, and had an amazing time. And I was like, I'm going to fly from Cartagena to, you know, where he went. And Dr. Laroche was like, just go on the next trip, Abu, because it's going to be too much. And it was, because, you know, you've been partying for 4 or 5 days straight. On the last day, it was kind of a lot. But anyway, it's definitely a trip that I will be on. And Dr. Laroche, can you please tell us where you went, what you guys did, and some of the significance of going to where you went, Dr. Laroche?
Well, earlier in the past year, we went to Benin. Is that the trip you're talking about, the Benin trip?
Yes.
Okay. Benin, you know, is a fascinating place. They speak French there.
Mm-hmm.
Okay. Some of my roots are from the Benin Kingdom over there in that respects. And they have different kingdoms. They have the Dahomey Kingdom. And I'm trying to think. I'm a little rusty right now because I didn't know you were going to talk about this trip. But they have different, the Abomi and Dahomey Kingdom. Okay. that are there. And so the kingdoms were fighting each other, okay? And by fighting each other, they were enslaving people and selling them in the slave trade, okay? And that was corrupted by the Europeans as well,
Of course.
in that respects. But the most fascinating thing about the trip, I mean, it's beautiful culture, beautiful art, beautiful people, very developed society. But the most beautiful thing that I learned was a town called Ganvi, Ganvie. Okay. This is like the Venice of Africa. There was a point in time where the people did not want to be enslaved. So instead of, being caught up into slavery, they went off into the waters. And 7 miles out into the waters, they found shallow land that they built a city on. And they go through canoes through these cities. Okay. And there's houses on stilts in the water. And 40,000 people still live out there today. They've been invited back to the land, but they said, no, we want to stay here. And they have developed their civilization where they do fishing. There's areas of water carved out for fishing. So if you look it up on Google, Ganvie, Ganvie, there's videos you can see, so you can take a look at that. And, we're on boats. And I wish I had known you want to talk about this, because I do have a lot of videos and slides. I've yet to prepare a presentation on it, but I can prepare a presentation on that trip. Maybe come back on a different day and do that.
Absolutely.
And
wonderful.
It was just fascinating. And I have video. I'm on a canoe and you're going through and you're seeing all of this. Because I never knew of that. I never heard of that. And it's like the Venice of Africa. And it's just a beautiful culture that evolved from this ugly thing of slavery, and how the beautiful city developed and evolved from that. I thought that was the most fascinating thing. And we got a chance to meet a couple of the kings. I have some picture with the kings, and they still have the kingdom there as well, but it's not political. It's more separated from the politics at all, in that respects. So they don't have any political power. But it was just interesting to learn the history and connecting to that with the motherland. And the group I went with were Haitian doctors. And a lot of the Haitian doctors, when you look at the Haitian doctors, a lot of Haitians came from Benin. And the local people, they look like the same people.
Oh, wow.
And they were like, wow, we look like we could be family.
Because you are.
Yeah. So that was another interesting thing as well. And so it was anytime you go back, I've been to Africa about 10 times.
Mm-hmm.
Anytime you go back, and particularly when you go back for the first time, it really will change your life around. You feel the warmth, you don't feel the white supremacy as much. And you just feel like you're back home type of thing. So for those of you who have not gone to Africa, I encourage you to go. There are various trips around. Jabari does a trip every year to Kemet and Ghana. There are other groups that go. I'm starting to do that myself. When we do conferences in Africa, we put posters up in our walls to advertise those trips, to invite our patients that want to go, to give them a chance to go. Because a lot of times people want to go, they just don't know how to do it.
Right.
So we have to expand, and as we continue to build relationships, bring people back and reconnect them in that respects.
Mm-hmm. Okay, great. Well, thank you so much for being on tonight. It's always a very informative and fact-based Tuesday talk when we have you on here. And since you have interests that vary, rooted in from an African perspective, of course, but because you do have different interests that are varied and you do pursue them with excellence, there's always something to learn with a good quality product that's accessible to all of our people. And I really, truly like that about you, Dr. Laroche. What you do, you bring it to the people. It's like you seek it to bring it to the people. And I'm really excited to see this book. I think we could do a wider, deeper breakdown on a Tuesday talk or something like that, because I think that's the book that's the book I've been looking for. It really is. So I want to thank you for being on the show. I'm pretty sure that I was able to get to all of the questions. I want to thank everyone for joining and supporting Tuesday Talk. If there's a guest or a topic or both that you'd like to be on the show, I am going to give you my email. It's segmentinmaat@gmail.com. Please feel free to email whenever you want. With that, I check it often, obviously. And where is it? Here it is, right here. And excuse me. And just reach out to me and let me know, and I will do my best to bring that topic and or that guest onto the show. Dr. Laroche, thank you so much for your time. I know you are a busy man and you are in high demand, so I appreciate it that when I ask you to be on the show, you come on and you always bring it with some new and good information. And people who are watching, don't forget, I'm going to give you those 2 websites and Dr. Laroche's contact information as I update the flyer that went out for tonight. Next Tuesday Talk will return to 9 p.m. New York City time. And I say New York City time because I don't know if you're an hour or 2 ahead or behind or daylight savings. I don't really keep up with that. As per announcements, it's always New York City time, baby. We always on NYC time, okay? I want to say thank you so much, and I'll see you next week. Go forth in divine balance. Shemem Ma'at.